Wings News. I'm Charles Soler.
And I'm Marina Rosado.
Today we're traveling a little bit around Africa, talking about human African trichomoniasis, which is a neglected tropical disease. What can you tell us about this disease?
Good morning everyone. Well, Charles, it's also known as sleeping sickness, and it's an infection caused by protozoan, a parasite belonging to the genus Trypanosoma. The disease is vector-borne. Parasites enters into the body through the bites of the ancestral flies. Without prompt diagnosis and treatment, the disease is usually fatal. The parasites multiply in the body, cross the blood-brain barrier, and invade the central nervous system.
This is really interesting. It's also important for traveling to Africa, the areas where you can find this disease. Sleeping sickness is found in the sub-Saharan areas where health systems are often weak.
Now we are going to show you some graphics about the distribution of two species. We can find the TB gaviese and the TB rhodesiense in 2014. Talking about the TB gaviese, it's an endemic in 24 countries of the West and Central Africa and causes more than 98% of the reported cases of sleeping sickness. In the last 19 years, the reported numbers of new cases of the chronic form of human African trichomoniasis fell by 95%, from 20,862 to just 1,412. Nowadays, the most affected country is the Democratic Republic of Congo.
On the other hand, TB rhodesiense is endemic in 15 countries of Western and Southern Africa, representing about 2% of reported cases. During the same period, the number of newly reported cases of the acute form of human African trichomoniasis fell by 96% from 619 to 27. It's especially present in Uganda and Malawi, and then with a few cases in the United Republic of Tanzania, Zambia, and Zimbabwe.
So, what are the most important signs and symptoms that this disease can cause to our attention spirit, Charles?
It can be caused specific symptoms and signs such as headaches, fever, weakness, pain in the joints, being in the dead body, and sickness.
So these symptoms are really similar to the common flu, are they?
Yes, they are. So it's really difficult in some cases to diagnose them properly. But when the parasite crosses the blood-brain barrier and migrates to the central nervous system, symptoms are worse. It leads to sleep disorder, hence the name sleeping sickness. Deep sensory disturbance, abnormal tone and mobility, ataxia, psychiatric disorders, seizures, coma, and ultimately death.
Talking about some difference between the type of trypanosoma, in the case of TB rhodesiense infection, the disease is acute, lasting from a few weeks to several months, while the TB gaviese infection, the disease is chronic, generally progressing slow over the several years. So, now that we have further information about the disease, we're going to talk with our correspondent in Africa. Hi Sam, can you hear me? Doctor? Hey Sam?
Are you there?
Good morning, Charles. Good morning, Marina. I'm Sam Smith, and hopefully now I can hear you. I am in the Republic of Congo with the expert of sleeping sickness, Lola Rico. Hello, Lola, and thank you to receive us.
Hello Sam, you're welcome. I'm very happy to be here and to be able to talk to you about this disease.
Could you explain us something about the treatment of sleeping sickness, Lola Rico?
For sure. Talking about the treatment, I'm going to start with the downside for it. For most of the 1790s, drug vaccine diagnostic and vector pathogenesis are imperfect and have limited use because of the toxicities, inadequate efficacies, or because they don't prevent the infection.
Perfect. What about the treatment nowadays? Is it better than some years ago? Did it change the
practical for large-scale test-centered efforts. Two NCEs, that means Newton's information theory, are currently undergoing clinical evaluation as qualifiers. Flexible method and the observer as one dose treatment. Several candidates are in the organization.
Thank you very much, Lola. Return the connection. Sam Smith, Republic of Congo.
Thank you so much, Sam. And now we are going to talk about the part of the vehicle these three hospitals takes after the ads.
It's fast. It's deadly to flying insects. It's not just a fly spray. It's revolutionary new rate. Watch